Donald Trump's transition team has announced plans to withdraw the United States from the World Health Organization on January 20th, 2025, the day he assumes office, according to a December 22, 2024, report by Hannah Kuchler and Oliver Barnes in the Financial Times. While framed as a bold rejection of multilateralism, this decision is a reckless retreat from global health leadership that jeopardizes public safety at home and abroad. Critics argue it is less about reforming the World Health Organization and more about deflecting from Trump's own failed public health policies. Framing this withdrawal as a symbolic reversal of Joe Biden's decision to rejoin the World Health Organization on his first day in office in 2021, the move threatens to undermine the organization's ability to combat pandemics and health crises. The U.S. is the largest single donor to the World Health Organization, contributing approximately 16% of its budget, funding critical to vaccine distribution, disease surveillance, and pandemic preparedness. Without this support, the World Health Organization faces reduced capacity to respond to health emergencies like COVID-19, H5N1 avian influenza, and health challenges exacerbated by climate change. Supporters of the decision argue that the World Health Organization is inefficient and overly aligned with China. This criticism was central to Trump's previous attempts to withdraw from the organization in 2020 during the early months of the COVID-19 pandemic. Trump's allies claim that withdrawing will either prompt structural reforms or allow the U.S. to focus on domestic health priorities. However, experts warn that this move could backfire. Lawrence Gostin, a global health law professor at Georgetown University, described the decision as catastrophic, noting that it would leave a power vacuum likely filled by China. Ashish, Biden's former COVID response coordinator, emphasized that disengaging from the World Health Organization would isolate the U.S. from critical health intelligence, leaving it unprepared for the next pandemic. Trump's own public health record casts doubt on the administration's rationale. His handling of the COVID-19 pandemic was widely criticized for its delayed and inconsistent response, contributing to over 400,000 American deaths by January 2021. Additionally, his administration rolled back policies like school nutrition standards, which were designed to combat childhood obesity, demonstrating a broader disregard for evidence-based public health measures. Compounding these concerns, Trump's nomination of vaccine skeptic Robert F. Kennedy Jr. to lead the Department of Health and Human Services raises fears about undermining public trust in vaccines at a time when confidence in science is crucial. Historically, isolationist policies have rarely succeeded. The U.S. Senate's rejection of the League of Nations after World War I weakened international cooperation and contributed to geopolitical instability in the interwar years. In today's interconnected world, global health challenges like pandemics and antibiotic resistance demand multilateral solutions. As WHO Director General Tedros Adhanom Ghebreyesus emphasized, the U.S. cannot be safe unless the rest of the world is safe. By withdrawing, the U.S. risks sidelining itself from critical discussions on global health, forfeiting its leadership role and reducing its ability to shape the future of global health policies. Reflecting on this decision, it becomes clear that leadership in global health isn't just about funding, it's about moral responsibility. The WHO has played a pivotal role in eradicating diseases like smallpox and coordinating responses to crises, saving millions of lives. Turning away now undermines decades of progress and cedes influence to nations whose agendas may not prioritize global well-being. Please subscribe to the Intellectualist's new YouTube channel where we present insightful videos analyzing the current events shaping the world. Turn on notifications to receive the latest updates from the channel.